Hello, good evening. You are watching a special pre-budget discussion. My name is Cynthia Ng, and today we will be talking about healthcare. Now, globally, healthcare costs is increasing and diseases are affecting people at a younger age. And how can we understand this new reality? And with the upcoming budget, if you look at last year, 19.3 billion was allocated to healthcare, and Malaysia spends about 4.7% of its GDP on healthcare. But beyond numbers and figures, the important question is how can healthcare better serve the people? And joining me today is Datuk Paul Selvaraj, who is regular on Awani. Thank you very much. He's the Secretary General, Federation of Malaysian Consumers Association, FOMCA. And next to him we have Dr. NKS Tarmasilan, President of Malaysia Medical Association. Thank you to both of you for coming on this discussion. Now, healthcare is really about anticipating for the worst, because you never really know when you are going to fall sick. And also joining me on the phone right now is a mother who had the unexpected, experienced the unexpected, who had this predicament of having her son diagnosed with bone cancer at the age of 18 years old. Hello, Karen.
Hello, yes.
Hi, Karen. Thank you very much for joining us.
Yeah.
I'd like to ask you questions regarding your son Alfred, who was diagnosed with bone cancer, more from the financial standpoint. As a family, because we're talking about healthcare costs, as a family, how prepared were you to face the complications of your son's cancer from the financial perspective?
It's very serious. Hello?
Yes, Karen?
Yeah, it's very taxing for the family, in fact.
Can you elaborate more about how did you find out about Alfred's condition, and then how much did you spend on his healthcare treatment?
Honestly, I didn't spend that much on healthcare because Telecom Malaysia, because my husband is working for them, they are actually paying for his medical bill.
Okay, when you found out about Alfred's condition, were you how did you feel about the financial burden? Perhaps you can talk. Can you elaborate a bit more?
Yeah, it was very taxing for us, you see, because I got to stop work, and everything we'll have to put on hold to see to his medical, hospitalizations, you know? And because we are staying in Ipoh, and we have to travel to KL very often for treatment, you see.
Okay, so how much did you spend?
Let's say if it's like medical bill, luckily, because he's under 21 that time, so it was by my husband's company. But we have to bear on other minor things, you see, like maybe anti-nausea medicine, which is very costly, and then all those, traveling expenses.
I imagine it must be very difficult for you because you had to stop work, and then at the same time you had to take care of your son Alfred.
Yes.
If you haven't had other options, that is, if you have found yourself in a situation whereby your family did not have the option to have your husband's employer to foot the bill, how would it have been for you?
It will be very at the end of the tunnel, which I was thinking of, ending my life and all these things, but I didn't, you see, because I was thinking of my son. So, and luckily I pray hard, you see, so help comes along, and luckily my husband's sibling and my sibling were very helpful then, you see.
So you had your family and friends to support you financially as well?
Yes.
With the benefits of the situation, how do you think you would have better prepared yourself for a situation that you have gone through like this?
What do you mean?
I mean financially, because a lot of people a lot of Malaysians have a similar situation as well, whereby they are diagnosed with critical illnesses but are unable to afford medical costs. How would you have better prepared yourself? Did you have an insurance policy?
I have one, but it's very minimum. It's actually more for his education, you see, and it's not meant for critical illness, you see, at that time when we bought, you see.
So the insurance just covered his medical bills? I mean, his hospitalization bills?
No medical, hospitalization, boarding money.
Okay.
No medication. Only boarding money.
Okay. All right. Thank you so much, Karen, for joining us.
Yes, okay.
Okay. I'd like to go to Dr. Paul first, because we look at Karen. She was fortunate that she has had the assistance of her husband's employers to help her out, but a lot of Malaysians do not have such option. And can you tell us about how can we better prepare ourselves financially? And with the existing healthcare model that we have the public sector and then we have the private sector running hand in hand, but has it served the Malaysian people optimally? What do you think?
Okay, Cynthia, looking at Karen's case, okay, one of the questions that was not clear is, did she go to private or government? Now, had she gone to a government hospital, the cost would have been manageable. And of course, it's additional helpful that her husband's insurance and the employment covered this. And that is an option that's available. Maybe one of the inconveniences is it could have been better if the facilities were available in Ipoh, so that the infrastructure in a state, I mean, Ipoh is a big state and it can cover at least the northern region so that people do not have to come to KL. But I think the bigger issue is that people are going to private sector. Now that is when the whole affordability comes in. And one of the puzzling things that we have found from our research is that we used to think that only middle class, rich people go to private hospitals. But now we find that a lot of poor and middle class people are going there. In fact, one research shows that 49% of those who go to private hospitals are poor and middle class. And they go because, of course, they love their children. Maybe their wait time is too long. And for them, it's a choice. Do I take my children or save money? And then they end up with financial problems. So this is where the seriousness of the issue is. I mean, we think that people should have more access to public services. Public healthcare should be more available at every level, whether it's in Ipoh or in smaller towns, so that the facilities is there. Healthcare must be seen as a right, and it's the government's responsibility to make sure that everyone has access and affordable healthcare.
Okay. Taking from your point about availability of government hospitals and in urban and rural areas, we have 230 private hospitals and we have 140 government hospitals. But the amount of people that we are serving from the public hospital and the private hospital, there is quite a huge disparity. We'll get into that later. Perhaps Dr. Dharma could help us with that. He's from the medical fraternity. But first, we go for our first commercial break. We'll be back with you shortly. Stay with us. So those were some of the tips how you can save on healthcare. But back to our topic, healthcare is becoming more expensive. And we look at the current healthcare system that we have the public and the private. Looking at figures, we have 230 private hospitals serving 97,000 patients, 3 million outpatients, and 140 government hospitals serving 2.3 million patients and 49 million outpatients last year. That's what the disparity.
Okay. Unfortunately, we have got a dichotomous healthcare system in Malaysia. Those who want to go to private and nothing else, and we got a safety wall for public hospitals where everybody sometimes goes as a last resort. And initially, I think even the Ministry of Health only took care of the public hospitals. Now they see the bigger picture, and they are including the private hospitals, the private facilities into the entire healthcare system. And as you have said, the figures, it's the 230 odd public hospitals are looking after almost 2.3 million admissions, and almost 49,000, 15 times more outpatients than the private sector.
So I would come to a conclusion that this is definitely straining the government hospitals,
yes,
public hospitals, and perhaps this is also why there is the demand for private hospitals, private specialists, and how can we realign these resources?
I think it's just amalgamating or putting the private and the public sector together, or work in tandem together, not as competitors. The public hospitals and clinics are overcrowded. Even the A&Es are overcrowded at night. And I think recently we had a complaint that he had to wait 6 hours in an A&E. So instead of doing that, you see, if my house is next door to a clinic, I can just walk up to the clinic and get a GP clinic and get the treatment instead of traveling 10 kilometers to an A&E. So the government should look into buying services from a GP clinic, say with a fixed sum, a fixed consultation fee. They can either provide the drugs or they can pay the cost of the drugs. So that way everybody is, the private sector is made use of. And instead of coming and clogging up the A&Es of the public hospitals. The other thing is in the hospital itself, surgical procedures sometimes there's a month-long or 3 months, 4 months waiting period. And private hospitals are underutilized. So they can buy the services to do the surgery there in that hospital, pay the fees, a reasonable fees, fixed a fee schedule, and make use of the facilities. And if necessary, is subsidized. They don't have to pay a complete bill. So there will be more usage. The government doesn't have to spend on infrastructure, building more hospitals, building more clinics. Instead of using, there are 7,000 odd GPs.
Who are not fully utilized.
There are more clinics there are more GP clinics than even government clinics. So they should allow the GPs to see some of these patients, and the government should pay for them. Why should a public servant only go to public hospitals? He can also go and see a GP, and the government should foot the bill.
Okay. Dr. Paul, your thoughts on his recommendation on doing that?
No, I agree that firstly we need to see how we can integrate both the services. One of the problems, of course, now is private sector is not regulated, and their first commitment is to their shareholders, not to their patients. That's why when patients go there, they cannot afford. They go there anyway because they need immediate care. And for the people who go for financial problems, the number one cause is cannot pay medical bills. It means people are using private hospitals when they cannot afford. Yeah. So I think one of the immediate things, I totally agree with what Dr. has said, that we should integrate. But I think as an immediate step, the government should regulate. FOMCA fully supports MMA's stand that fee schedules in private hospitals should be regulated. There cannot be such a disparity between public and private hospitals that it just becomes unaffordable, and people get into financial troubles. I mean, the minister recently said, the number of specialists, it's absurd. The number of people going to government hospitals, so many, yeah? But specialists, there are 3,007 specialists in government hospitals, 8,000 in private hospitals. So why this disparity? Because it's so attractive in the private hospitals that, the doctors, if they want to earn a better income, they go there and end up with shortages in the government hospitals, long waiting time. So I think we've got to look at this as a system so that we give priority. We should take care of our doctors in the public sector, but we should also, I feel, reduce the disparity between public and private hospitals. Only then I think there is something positive forward. If not, I think it's going to be difficult.
And Dr. Tharma, how do you think we can draw these medical practitioners? Like he mentioned, that the benefits are better, perhaps in private hospital, but at the same time, we do have a huge amount of medical practitioners in government hospitals, but why are we still facing blockages in public hospitals like this?
See, it's a very a plethora of doctors, excess of doctors in the lower ranks, the trainee level, houseman level. The base is so wide, but the fulcrum, when you go upwards, the specialist is few. The MMA has demanded and has appealed to the MOH to create more specialist posts. But the irony is, the ministry tells us that there are not enough qualified medical officers to enter those 800 posts itself. So it's no point of increasing the specialist post. There must be enough doctors. enough trained doctors in the first place. The other thing the government is doing is, I think if you look at it, I mean, the Ministry of Services, Health Services has improved tremendously over the years. And now it is not worthwhile for a medical officer to resign and go and start private practice, because it's much more meaningful to work in government service because the perks are there, the salary is comparable.
Right.
But of course, it is the specialist salaries which causes the wide disparity. And I think the MMA is also fighting on that issue. And I think over a period of time, that too will increase. And I think this drain to the drainage of the brain drain to the private sector by medical officers to become GPs has almost virtually stopped. Is very, very minimal. But the specialists brain drain into the private sector is still continuing. And I think the efforts that the Ministry of Health is doing now with more specialists, with better perks, and I think it'll be a couple of years' time before we see a meaningful pay rise to keep them in government service. But I think that's it's not a tall order, but I think the government is contemplating, and I think until they increase the GP, the allocation to the health budget, they will not be able to address this issue.
Okay, I have to go for last commercial break, but when we come back, we'll go closer to the budget, allocation, money, but where do you want the money to go to? How can we use the money and translate it to something that really impact people? Yes, we have one, Malaysia clinics, and where does the clinic should be to serve the people that needs it the most, perhaps more in rural areas instead of urban areas? We'll get to that shortly after this break. Stay with us. Hi, you're watching a special episode of Agenda Awani leading up to the budget. I'd like to go to Dr. Paul. Perhaps when we talk about healthcare, ultimately what we want is to make healthcare affordable to people, but at the same time, how can we run it in a sustainable way? What kind of model is suited? You mentioned public-private partnership, but how can your thoughts about that?
Okay, firstly, the budget itself. I mean, we are spending less than 5% on our healthcare. WHO says at least 6% and above, so we need to spend more. And one of the biggest manifestations with low budget like this is long waiting times. So I want to see a specialist, you're given maybe 6 months, 7 months, and that's why people end up going to the private hospitals. So when a patient goes, I mean, there should be reasonable, you should be able to see a specialist reasonably short time, and if there's any procedure to be done, I think if you can bring that there, that'll be really helpful to skip people to the public service. Secondly, I hope that the government will act to keep the specialist in whatever, this is of course what Dr. said about the welfare. Healthcare must be given that special priority to keep the specialist in the public service so that it becomes accessible. And the third, I mean, Karen had to come from Ipoh to KL. I think we need to look at decentralizing so that this kind of services are available in the big towns. Maybe more services are available in the small towns. So only in very exceptional cases. And I know people from Sabah, Sarawak who have to come here for treatment. Now, the whole lifestyle is turned upside down, you know. So we need to move towards decentralizing so that it's not only affordable, it's also accessible. On the private sector side, I hope government can regulate so that when I go, firstly, fees are reasonable, whatever that means, and we need to be more transparent. Too many people only know the bill when they're checking out and they get a huge bill. So we need to be transparent about billing, and then, you know, a patient should be able to compare different hospitals and make choices. Currently, you know, because the pricing is so opaque, they're not able to do that. So if the difference between private and public sector can be less, I think it will be more accessible, and I think the resources that are available will be more accessible to all. So it must be both accessible as well as affordable. That's what, as a consumer movement, we hope for.
Okay. Dr. Tharma, from the medical fraternity's standpoint.
Okay, the ideal healthcare system will be a national health financing scheme, where everybody who is gainfully employed contributes some amount, predetermined amount. But unfortunately, if you look at the world scenario, there is no tested system that is ideal. Look at the NHS in UK, it's almost falling apart. Look at Obamacare in USA. There are 40 million Americans who are uninsured and who do not have access to medical care. You look at Japan, Korea, Taiwan. They have also have health care systems and insurance schemes that are evolved around Harvard economic patterns, but that doesn't work either. To be fair to the government, I think they've done a wonderful job this far. We got a health system that we can be proud of. You'll only know how good our system is until you go abroad and you find that there's no easy access to healthcare. In Malaysia, even foreigners get healthcare. It's a well-oiled machine,
yeah.
Our healthcare system. But probably you need a few tweaks here and there to make it
better than how it is now.
And as you said, when better is possible, good is never enough. So we should aim for the better. So I think the most important thing, I think, if you look at our budget allocation to the healthcare, it's a miserable 4.7%, out of which only less than half is paid by the government, 2.2%. But having said that, in 1997, the budget was only about 8 billion, which is about 2% of the GDP. Now we are spending almost 37 billion because we're taking as percentage of the GDP, it looks small. But just if the government increases the budget allocation by just 1%, all this can be definitely be taken care of. And that 1% will be...
My question is, if you get a bigger allocation, where do you want it to be?
Of course, the government has to...
be focusing on?
The government should not be... should integrate with the public sector and not waste too much of money on infrastructure.
Right.
Because the infrastructure is already there. There are enough private hospitals. There are more private hospitals than public hospitals. And the private hospitals are underutilized. There are 7,000 GP clinics who are not utilized. There are more clinics, GP clinics than even government clinics. So these people should be used, and that money that the extra money that's allocated to GDP can be used for treating people like the unfortunate lady that had a son die because she had difficulty in getting the drugs. And but
all in all, I would say that you're saying that we should better manage the resources that we already currently have,
yes.
and better private-public partnership, more integrated healthcare.
Yeah.
But thank you, Dr. Tharma and Dr. Paul, for coming on the show, and thank you for watching. If you have any questions or feedback, you can drop us a line on our Facebook, our email, our Twitter, and also you can download our Awani application on iOS or also on Google Play for the application. And thank you so much for watching once again, and we'll see you again next week on another special pre-budget discussion. Thank you. My name is Cynthia Ng, and good night.